how is it that families really work? And more importantly, how is it that people within families can get better when it's not just the individual that's being affected, but it's really everybody in the family? Jay Haley had that question, and in working with Milton Erickson, it's a different Erickson than we're used to, but Milton Erickson, and in looking at an anthropologist named Bateson's theory, he began to put together that what was really important was the overall strategic look at how each person worked in the family. So, strategic family therapy was Haley and several other therapists' a contribution to how to work with families, and it's still active today. He began in the 50s and 60s in putting this together, and it's still evolving, it's still coming of age really, even today, so that when we look at strategic family therapy, you see it morphing into a bunch of different systems, including brief strategic family therapy with very limited sessions, and many other kinds that you'll see current today. But it all started with Haley as influenced by Erickson, Milton Erickson, and Bateson, as well as others. So, what are you looking at when you're looking at strategic family therapy? The basic principles are that it's based not so much on the insight model, that you're not trying to get the people to understand their actions. You're trying to get them to understand the process. What is it that's going on in the family? They don't have to understand it to see the process itself. So it's based on process. It's very therapist-centered. That is, that the therapist is going to be very involved in giving direction, in sometimes giving even contrary directions, and we'll talk about that in just a sec. But it's very different from the Rogerian model, where the therapist seeks to be almost invisible. The therapist is right in the thick of it, and a huge part of the therapy, indispensable in a lot of ways. The basic idea is that people are always communicating. There are always messages going across, and communication is either report, that is, I'm telling you something, or a command, I'm telling you to do something. And it has four elements to it. That is, that I am communicating something to you in this situation. So 4 parts to it. I, part A, am communicating something, part 2, to you, part 3, in this situation, part 4. And all of these communications can be looked at and analyzed, and that process is called meta-communication, where we actually look at the process of communication itself and discuss how that's affecting the overall strategy of getting the family to be better. So, meta-communication. Now, he found out, and his theory goes, that generally speaking, families try to stay the same. Whatever the situation is, wherever they are in life, and whether it's good or bad, they try to stay the same, and that's called homeostasis. Homeo, from the Greek homeo, that means the same, and stasis, that means wall. So that we're staying the same, we're building a wall around change, and whether it's good or bad, he noticed that families try to maintain this. And of course, if it's bad, then they keep going in the same direction. And this causes what he saw as circular causality. In other words, we're trying to keep our family the same, and that's what we're after, so that if we get into a problem, we keep repeating the problem, because now that's part of the sameness that we as a family are trying to maintain. He called that a feedback loop. And here's where you saw Bateson's influence on there, because he worked with cybernetics. That is, seeing how family systems are replicated in computer systems. And in computers, of course, you get these feedback loops where a program goes endlessly around itself. And he saw, Haley did, that there was a connection between how families work and how computers were working. And he called that process of the endless repeating argument that goes on, or the endlessly repeating problem that happens between families, as a positive feedback loop, because it was not positive in the sense of something you wanted to happen, but it was a positive action within the family that was acting to keep that homeostasis where it was. So the positive feedback loop is something that you want to poke a stick into to stop it. And here's how the kind of change that you're looking for. You want to either change the behavior itself so that it changes the system. That's a first order change. Or you want a second order change when the rule affecting the behavior changes. So you either change the behavior itself, or you change the family's rule that's keeping the behavior going. In other words, you stop the homeostasis. Now, normal family development he saw as happening in two ways. All families will try to maintain integrity in the face of environment trying to change them. But what they do, a happy family, a normal family, and what you're trying to move a dysfunctional family toward, is that they're trying to adapt to that change in a way that maintains their integrity through the negative feedback. That is, that whenever you do something and you recognize it's not working, a healthy family will do what? They'll change in response to it so that their family maintains integrity, but that it doesn't cause a problem within the structure. And that's what you're trying to foster within the dysfunctional families. So that basically then what you're trying to do is give the families tools to work with, not to gain insight into the problem, but to change the way they communicate and behave to one another. And if you can change that, then you can strategically change the structure of the family. Now, he saw some of these, and these terms will be important for you to remember, as coming in the form of what he called paradoxical injunctions. That is, asking people to do things and communicating to them in a way that make it impossible for them to comply, so that it would be something like demanding a behavior that can only be spontaneous. You need to love me more, now! And of course you can't demand that of somebody. So that the paradoxical injunction is something that's going to be impossible to comply with, and yet of course by asking the command you've expected compliance. And this causes what he called a double bind. That is, it was given two messages at once that you can't fill both of them. So I want you, here's an example. I'm asking you to tell me how you feel. You tell me how you feel, and I yell at you for telling me how you feel. Well, now I've given you two different things. I told you to be honest, and now I've yelled at you for being honest. And those double binds are what cause the communication problems within the family. And basically, he saw three different explanations for malfunction within the strategic family system. One was the cybernetic that we've already talked about, the positive feedback loop that begins to go back on itself and keeps getting replicated even if you recognize it's unhealthy. The second was what he called an incongruous hierarchy. That is, that in any family there's going to be people who lead, and generally that's the parents, and people who follow, generally that's the children. An incongruous hierarchy, then, is one that's flipped over, where the children begin to take the leadership role that's unnatural to them, and that begins to cause a problem within the family system. And then finally, the function of the family itself. That is, every system within a family serves a function. Now, it can be a dysfunctional function, it can be one that causes unhappiness, but it still has a function within keeping the family the same. Remember that homeostasis. So that if you can determine the function of the behavior, now you can stop it. And how does that happen? Well, the goals of therapy are this: that you're going to define complaints that can be resolved, that you're going to identify attempted solutions and see how well they worked, to be able to determine whether that's something you need to keep doing or stop doing. It's where the meta-communication comes in. To understand the client's language in describing the problem, so that once you understood how they're using the vocabulary in describing the problem, you can see the source of the problem and work to stop that causality loop. And finally, that one of the goals of therapy will be the paradoxical directives that the therapist is going to be giving in order to help the people understand not so much gain insight into the source of the problem itself, but how the problem is starting so that it can be stopped. The counseling process will generally include an introduction to the treatment setup, will ask about the nature of the problem itself, will try to estimate the scope of the problem within the family, will then set goals for treatment, will select and make behavioral interventions, and this is where that therapist proactivity will come in, and finally will terminate therapy. And almost always it has a very definite ending point, sometimes as few as 10 sessions. Begins and ends and it doesn't go on because you're dealing with a problem, you fix the problem, and you move on. And if the family recognizes that they have another problem, then they come back and you deal with that problem and you move on. It's not an open-ended thing. There's always a termination time. Now, what are some of the techniques that we're talking about here? Well, as I've said, it's to assess the family problem and then to use interventions that are goal-oriented and they're step-by-step, so that if you see a problem happening, you determine a goal for dealing with that specific problem. My child always whines when I go into the department store. How are we going to deal with that? Specific problem, specific answer. The therapist is always direct and in charge. It's never a question about who's, doing what in the therapy itself. And it has a large use of what they call relabeling or reframing. That is, to take a problem and to be able to look at it through that metacommunicative process and to look at it from another angle so that you can see what might have been seen as a negative in positive terms. And the use of paradoxical interventions. That is, and here are some of the things you'll need to know, prescribing a symptom. That is, seeing the symptom itself, but now asking the person within the family or the family itself to do specifically what they see the problem as doing. Now, this is specifically designed to cause resistance within the family, and through that resistance, they now clearly see the problem for itself and are able to work on it. Another paradoxical directive is a restraining strategy. That is, most of the time when a family sees that a problem has been identified, the natural thing that you want to do is to fix it now. What the therapist will do is to tell them to go slow, and to go as slow as they can. And of course, that's unnatural to them, so that's the paradoxical nature of it. And in that paradoxical nature, then the family begins to have their own impetus to work out the problem. And finally, what's called a positioning strategy. That is, looking at the family's perception of their problem and exaggerating it so they see it as worse than it is, so that they'll want to work on it more. And the therapist, in using these paradoxical interventions, can then help the family to want to work on their problem in a more direct way. So, let's review. Jay Haley, one of the beginners of it, through Milton Erickson and Bateson's research that they had done, is a focus on process, not insight. That what you're trying to do is recognize the family homeostasis, the desire of families to stay the same, even in the midst of a dysfunctional situation. That it has a basis in cybernetics, that is, using a computer language to talk about family problems, and specifically in terms of positive feedback loops. Continuing a behavior even when you notice that it's a dysfunction within the family. That you're looking for incongruous hierarchies, flipping around the way that the family should really be working. That you're looking for systemic function, the overall strategic look of how the family is going. That problems come in dysfunctional messages and paradoxical injunctions, two commands that are mutually exclusive and can't both be done by the same person. That oftentimes a goal of therapy will be to reframe the problem so that the family can see it in a different light. And finally, that the therapist will give paradoxical directives to the people in therapy in order to help them highlight their problems and so work on it in a different way. And that's strategic family therapy. That's what you need to know. Good luck.